Okay, we're going to do some trach care on Mrs. Smith here. Before going to the patient's room, I went ahead and collected my supplies. I had a sterile suction kit, canister suction, trach care kit, any PPE that I might need that's not in the room, like a face mask. I'm also going to get some sterile saline syringes and a trach um, mask to oxygenate my patient. So, upon entering, knock knock, hi Mrs. Smith, my name's Kate, I'm from the respiratory care team. Today we're going to do some trach care on you, okay? Let me just go ahead and set up my stuff. I'll go ahead and wash my hands, put on some gloves, set up the suctioning canister, and then I'll go ahead and assess my patient. Vital signs, SpO2, I'm going to check the cuff pressure to make sure it's between 20 and 30, and we're going to go ahead and start the sterile portion of trach care. So I have my sterile suctioning catheter tray. I'll go ahead and open it. You'll have gloves, a clean hand, and a sterile hand. I'll go ahead and only touch a catheter with my sterile hand. I can get on my hand with my clean hand, and then we'll go ahead and hook up the catheter to the wall. All right, Mrs. Smith, we're going to go ahead and suction it out real quick, okay? Make sure I got it nice and lubricated. And we'll go ahead and insert. When I feel a little resistance, I know I've hit the carotid there, so I want to back up before I start suctioning. And we'll make sure we do this no more than 15 seconds, okay? Now she's nice and suctioned. And now we can go ahead and start with the trach cleaning portion. So I'll go ahead. I don't know if I mentioned, I should have hyperoxygenated my patient while I was setting up the suction. So if not, I would have done that, and then afterwards I can hyperoxygenate her as well. Always making sure I'm watching her vitals. So the next thing we need to do is we'll go ahead and take out her inner cannula. This is a disposable one, so we can just get rid of it. If it was one that needed to be clean, our suction or our trach care does have some pipettes, and we can go ahead and clean it with some sterile saline and let it air dry in a safe place while we're cleaning the stoma site. So now we can go ahead and take off this gauze. I would have untied the necktie of the trach collar, and then with our sterile Q-tips and saline, I'm going to go ahead and make sure I hold down the trach and go from the inward out, disposing each time of my Q-tips and getting a new Q-tip and going inward out. While I'm cleaning, I'm monitoring the stoma site, looking for any excessive drainage or redness, irritation, foul odor, anything like that. So now that I've done both sides and cleaned up her trach, I can go ahead and put a new foam pad or gauze on for Mrs. Smith, and I'll secure her trach collar. And then I'm going to go ahead and assess my patient, or no, before I do that, I have to put in the new trach. Okay, we'll insert the new inner cannula there. Now I can make sure I'll assess my patient, make sure this cuff pressure maintained in between 20 and 30. We can clean up and listen to some breath sounds, see that our SpO2 was good, keep her head in a comfortable position, and make sure she has her call light and she is all set. And that's it.